One area of fluoride research that has generated significant attention and concern in recent years is fluoride's potential adverse health effects on children. Paul Conant, PhD, the director of the Fluoride Action Network, also called FAN, recently summarized the scientific evidence on this topic. Quote, as of 2020, there have been 72 fluoride IQ studies, of which 64 found a lower IQ among children with higher fluoride exposure. Many of the earlier studies were in places with elevated natural fluoride levels. There is now very strong evidence that fluoride damages both the fetal and infant brain at the levels used in artificially fluoridated areas, end quote. Dr. Conant added, quote, you only have to read 4 studies to realize that deliberately adding fluoride to drinking water unnecessarily endangers children's brains. 3 of these 4 studies were funded by the National Institutes of Health, end quote. The 4 studies Dr. Conant of the Fluoride Action Network is referring to are the following. Number 1, Bashash et al. The study is called Prenatal Fluoride Exposure and Cognitive Outcomes in Children at 4 and 6 to 12 years of age in Mexico. It was published in Environmental Health Perspectives in 2017 and funded by the NIH. This study, conducted in Mexico and covering 13 years, found that every 1/2 milligram per liter increase in fluoride in pregnant women's urine, approximately the difference caused by ingestion of fluoridated water, was associated with a reduction in their children's IQ by about 3 points. The second study is Green et al.'s Association between maternal fluoride exposure during pregnancy and IQ scores in offspring in Canada. It was published in JAMA Pediatrics in 2019 and funded by the NIH. The physician editor of JAMA Pediatrics remarked about this study, quote, I would not have my wife drink fluoridated water, end quote, if she was pregnant. Third study is by Riddell et al.'s Association of Water Fluoride and Urinary Fluoride Concentrations with Attention Deficit Hyperactivity Disorder in Canadian Youth. It was published in Environment International in 2019. This Canadian study found a nearly 300% higher risk of ADHD for children living in fluoridated areas, which reinforced earlier studies linking fluoride to ADHD in Mexico and the United States. And the fourth study was Christine Till et al.'s Fluoride Exposure from Infant Formula and Child IQ in a Canadian Birth Cohort. It was published in Environment International in 2020 and funded by the NIH. The following video offers Dr. Conant's comments on the importance of this research.